Okay, hi everyone. This is Jen, and I am coming to you from Fort Worth, Texas. It's about 7 o'clock Eastern time here. When I do the videos, most time I do them in the evening due to my schedule. I know I've missed past 2 weeks just because life happening, lots of things going on at work this time of year, especially as we are gearing up for a lot of our projects being due in employee health. Also, as we prepare for cold and flu season, and what that means for employee health, occupational health nurses, and what that looks like. And we're going to a new computer system also in the midst of all that. So, and then on the home front, a lot of exciting things happening, a lot of decisions going on behind the scenes, all good, and I'll update you when we actually have more solid, solid concrete plans of everything. So tonight, just want to hop on, talk about a couple different hot topics in healthcare and healthcare hot topics that are near and dear to my heart. And there's some I don't talk about as much online. I do in person, just not online, especially in today's political climate. And is what I will say about that is just please, no matter, go vote, make sure you're registered to vote. However, I want to talk about how healthcare and politics are intertwined no matter who is in charge, related to working in the hospital, such as staffing ratios. Right now, I believe they are trying to change this in some states. California being one of the only states that I know of, this could have changed. So you guys can fact check me, please do. I know for a while, California was one of the only states that had, in their law for nurses, a patient to staff ratio. And the argument other hospitals and other states have, their argument is, oh, it should be, based on acuity, and whereas can understand that, but, where do you draw the line of acuity, and what does that mean? And in terms of how sick a patient is, because we do see the evidence that the more staff, equals, more staff equals better quality of care and better outcomes. So what is that, safe line that is going to keep, patients safe? And I also understand the other part of keeping the hospital financially safe also. And so with a lot of things, it's a very, very fine line. However, there are ways that in some areas there has to be a safer way for nurses or techs to do their jobs, especially in many, many places now, no matter where healthcare givers work, whether it's nurses, techs, having to deal with increased workplace violence, no matter where they work. And unfortunately, that's even as you see it in the community, even at fast food restaurants, in the schools, and those same people that you're seeing in, the viral TikTok videos, whatever, those same people that you're seeing acting like that are also coming into the hospital, acting that, same way, and treating our staff like that, unfortunately. And that's very, very hard. I know some hospital systems have enacted policies. Some states, there are laws, and this is why I say, this is where healthcare and politics sometimes get intertwined. As some states do have it to where if you are assaulted by a patient, you can press charges. However, it's really hard depending, is your employer going to back you up? Or are they going to be, oh, that person didn't mean it. So you have to, do what is right for you in that situation. Also, if it's somebody who maybe has a mental health issue, and this is where it's a very, very delicate line. If that person maybe truly was having a psychotic break and didn't know what they were doing, then you could see, well, okay, maybe in that moment they didn't know what they were doing. But then if somebody else who did know what they were doing and then just using their mental health diagnosis as an excuse, which sometimes has happened, and then, the judge is like, oh, this person has a mental health issue, and then that person, there's no punishment, even though they've completely physically assaulted, a nurse, a doctor, radiology tech, patient care technician, whatever. So sometimes for that, unfortunately, there is no consequence. And then that person, comes back to the hospital, unfortunately. And then care can't be denied to that person because there's laws about denying care to people. So it's kind of like, where do you draw that line? And I'm not saying I have all the answers on this at all, but I think it does with that. We need to have conversations about it. I know there's other parts of healthcare, there's lots of other conversations on both sides, having those type of conversations, which is great. And so some of these other conversations are falling to the wayside, sometimes falling through the cracks and just really not being listened to, and they are just as important. Just like I know there's one group of nurses right now who are petitioning for reimbursement, and I think that's great, and that's what they want to do. That is great. I am not judging that. I just know it's very hard even for physicians to get reimbursed. I know how hard it is for people providing, physical therapy for therapists to get reimbursed for insurance companies for their time, psychiatrists, the social workers, counselors for their time and everything they do. So for the nursing care, I know there are talks in this, an association, how that is going to work. I am not 100% sure. It might be a really great thing coming forward. I want to know a little bit more about that as somebody who has worked in utilization review. How are the insurance companies going to come alongside that? And I do understand the other side, of really showing the value that nurses bring. Because sometimes it's really hard to show in a dollar amount, the value of the care that nurses bring, when that is sometimes the highest cost in the hospital setting. So if they can do that, that would be really great. I need to look more into that to see how that would work. I honestly don't know enough about that. So I would really like to dive a little bit more into that, get more information for me to have a more informed opinion on it, do my research like I, want you guys to do. For healthcare topics, have your own informed opinion. And with that, make sure you're getting, the gold standard, which is having something peer reviewed, making sure you look at who is putting that study forward, who is paying for that study, to see what the bias is in those studies. And, the other issue in healthcare too is, non-compete agreements, where they were gonna ban non-competes, and then the rules got, overturned on that. And right now, I believe it's 37 to 45% of physicians are under non-compete agreements right now. And in the other labor market, it is 1/5. And that was when I looked at the numbers before jumping on here. 30 million people in the US currently under non-competes. So that can make it very, very hard. Like, I do understand if it's somebody in an executive position where you've spent, thousands upon thousands of dollars of recruiting, headhunting, giving them this golden parachute package, and spent a lot of time, money, and energy into that. But other than that, I do not think that they should have non-competes. That's just my personal opinion on that, because a lot of people do actually work at competing places. I know people, like when I lived in Ohio, there's people that worked, they would work at Ohio Health, and then, they might have, also worked at ProMedica, or they could have also worked at Ohio Health and, a neighboring hospital. Or some of them could work at the Ohio State and had a PRN job on the weekends across the border at the University of Michigan. So where there might have been a non-compete with those two in their job description, a lot of people, if the employer didn't find out, but then if they did, that could have caused, possibly termination in their employment. So if there is a non-compete, make sure you look at everything you're signing when you're signing your benefits, when you are signing that job offer letter. Make sure that you are reading the fine print regarding sign-on bonus, regarding if there is a non-compete or not. So with just the way our medical system here is in the US, I'm not saying, there's a lot of people that I know that live in other countries that pay a lot higher tax than we do for universal health care. And some of them, for certain things, procedures, especially those living in Canada that I know of, have come down here for surgery, so they do not have to wait, because the wait list in Canada could be very, very long depending on the situation. And, if they want to get their loved one, that CT scan, that MRI, that outpatient surgery, whatever it is, a lot of them will pay that out of pocket. And I know not everybody can afford that. And then, knowing the cost of healthcare, the cost of insurance, and understanding that, in the US, that is the number one reason people go bankrupt. It is medical bankruptcy. If people have a child that, maybe was born, unfortunately, a couple weeks early in the NICU, that is, really expensive, bill. And, that is, unfortunately very expensive for that family. And then if it's a baby born in the NICU, it might have other problems later on, or, maybe other complications, or a kid that gets sick later on, or parent, whatever that situation is, that even if you have, really good insurance through your employer, there, even with that, having really great insurance, you could still end up just being wiped out from the medical bills. So then it's like, what, where do we go? I'm not saying that, the Affordable Care Act is the best answer, but what other answers or solutions is there? I know, for example, say Social Security. That was originally designed, it wasn't originally designed as retirement. And in this day and age, unfortunately, that's what is retirement for a lot of people. And I'm not going to say because they didn't save, but, people that are older, especially women, older, where they, can't have, their own bank account, housing till, 70s, 80s, credit cards, those type of things. And, then had to, rely on their husbands and their husband's pension, then, say, eventually then, their husband passed. And then, with everything, and then that pension many times just went away. So even this person could have done everything right, and then everything, unfortunately, gone. So they could have, saved. So I don't want to put like any type of judgment out there. But that wasn't designed to be the retirement. It was designed to be a supplement. And I do know the majority of Americans, that is their, retirement. And I do know for a lot of people, for Medicare, and I'm not going to, judge that at all. That is the insurance benefit most people over 65 have, unless it's, some type of disability, and if they've had a disability for a certain number of years. Or, if somebody's had VA benefits, those are benefits they've earned. It's not entitlement. That's a hill I will probably die on, where that is a benefit that they've earned. But still, the medical care in our country is so high. And then finding, really, good providers, and these providers have gotten so burnt out, it's hard to get providers now because they've just gotten so burnt out because they can't see the patients how they want to treat them, which is sad. And is what I mean by that is see them in sometimes a more holistic approach, when, a lot of times they have to see so many patients in a small amount of time to get, a certain amount of money or whatever that looks like, because it's no longer, your family doctor that you've had for years. Most family doctors now, the majority of them are in with, a big medical group. And I know that's happened to a lot of my doctors. You don't have the doctor usually. Your family doctor is not coming to the hospital, anymore, providing, your care. You're going to have, probably a hospitalist and then follow up with your doctor when you go home. So that makes it, a little bit harder to have, quality care all the way through with somebody who really, knows you. And then some of the ones that are really fighting the, non-competes and safe patient ratios are a lot of the hospital associations, which that kind of like blew my mind. I don't know why it did, but it did. And then we have also in the US, how expensive it is, to have children nowadays. And I know children are a blessing. I absolutely think that, whether, it's being a bonus parent, adoption, via surrogacy, IVF, however, but I do know it does, I think the last statistic, can't speak. And I think it said for one child is like $250,000, but I'm sure with inflation, that's probably a little bit higher. So I understand why people are delaying having children. But again, also in the US, our maternity leave for most places where I work, it's pretty good. It's not that great. And even for fathers to bond with a baby, it's not the greatest. So that's where I'm saying, healthcare and politics collide. I mean, there is, Family Medical Leave Act, but that's unpaid. And especially if you have a little one, brand new baby, you're, and they cost, to raise a child, $250,000, you need, some money to care for that, versus being unpaid. So I do think there needs to be, more common sense approach to maternity and paternity leave, because fathers do need a bond with the kids, the newborns, and also if there's other kids to help out for a little bit while mom's recovering of just having a baby, because also not all families live close by in this day and age. I mean, my family lives most of my family lives in Ohio. Bruce's family lives, his daughter now lives like several hours away. His parents live in South Carolina, so they live far away. And so I know a lot of other people, their parents, live far away. And so it's really hard when they have little ones, especially if their parents are working, if they're young, having kids, late 20s, early 30s, their parents, 50s are still working and can take, some vacation time. But then, they need to have, some vacation time for themselves also, which is not being selfish. So it's those balances of, let's, have a little bit more, time off. And then there's going to be people that say, well, I should have time off too, because, even though I didn't have a kid, because, it's not fair because this person gets time off, because they have a kid and I didn't. And so then that might be a conversation of, maybe this other person, if they don't have, a child, or people that don't have children a certain number of years, maybe they get extra, time off. I don't know what the answer is there. But I know it's not always going to be fair. It's kind of, you're not always going to make everybody happy, but I do think it needs to be more common sense. And some of these laws in healthcare regarding, the non-competes, staffing ratios, a lot of them, it's not done by healthcare providers. It's usually done by lobbyists. I know this firsthand, not from my current employer, but when the Affordable Care Act several years ago, when that was trying to be repealed, I do know the employer at the time that they had said, hey, we're sending in lobbyists to, Washington, D.C. to write this. And I was like, and this was actually an insurance company doing that. And I was like, wow. And then another place I worked had, for a different situation, they had lobbyists to, I believe this one was more at the state level. And I think that was the first time, when I was like, oh, there are actually lobbyists in healthcare. And really, it opened my eyes to how certain decisions in healthcare were being made. Because I think before that, I was probably very naive about that, or just, not fully understanding how a lot of these laws, just regarding, staffing, reimbursement, non-competes, all went into effect. And so it was just for myself, really eye-opening. So I just want to come on and, share some of those topics with you. And just, drop in the comments, something that you learned here tonight that, maybe you didn't already know. And now as it's coming to that, lovely cold and flu season, make sure you guys are washing your hands. Make sure if you have little ones, having them wash their hands when they come through the door, because hand washing is the #1 way to prevent infection. And one of the things I do is I also I have a pair of shoes for work that I leave right by the door. I really try not to track those shoes all over the house. So that's just one of the things I do. Let me also know if you do that. And I will see you all next week.